Hi guys, welcome to my YouTube channel. My name is Nurse Hlaliz and I am here on your screens again today for another video. This is actually the first video of the pregnancy series and I'm so excited to be doing this series. Thank you so much to everyone who watched my intro video, and thank you for the warm reception and the love that you showed it. It's really motivated me to continue doing this. I'm really happy. So I really appreciate everyone who supported me, who watched the video, who subscribed to my channel. I really appreciate it. So as I said, today I am doing the first video of the pregnancy series, and today we are talking about how to plan for pregnancy. If you enjoy this video, please do give it a thumbs up. Please subscribe to my channel, hit the notification bell so that you can be part of the notification gang and know every time when I post a new video. And obviously please do share this video to other people so that they can be able to benefit from this very crucial information that I will be sharing in this video. Alright, so I mentioned in my intro video that I will be doing the pregnancy series. I will be taking you guys throughout that whole process of pregnancy, from before a woman falls pregnant, throughout the pregnancy, till after she delivers her baby. So if you are pregnant, if you are planning on falling pregnant, or you know anyone who is planning on having a baby in the future, then I suggest that you stick around for these videos in this pregnancy series, because I think that they're going to help you a lot to be so much more prepared for your pregnancy. Alright, so in this video series I am going to be answering 3 questions for you. The first question is, why should a woman plan to fall pregnant? When should a woman start planning to fall pregnant? And then third question, how can a woman plan or prepare for her pregnancy? Let's answer the first question, why should a woman plan for pregnancy? Pregnancy is one of the most beautiful journeys that any woman can go through, but at the same time it can be one of the most traumatic experiences that a woman can ever go through because of the complications that may arise in the pregnancy. So what can a woman do to try and reduce the complications that may arise? That's where planning comes in. It's so important for a woman to plan her pregnancy so that she can try by all means to reduce the amount of complications that arise, so that she can try by all means to increase her chances of having a successful pregnancy that will result in the delivery of a healthy baby. So that is why it's important for each and every woman to plan for pregnancy. The second question is, when should a woman start preparing? As soon as a woman reaches her reproductive ages, and as soon as a woman gets into a committed relationship such as marriage, it's advisable that she prepares. She starts thinking about the future. When would she like to fall pregnant? How many kids would she like to have? And how far apart would she like to space those children? That is very important, because the amount of time that a woman waits in between her pregnancies can actually affect the outcome of her pregnancies. So that's the second question, which is, when should a woman start preparing? The bulk of this video is going to be answering the third question, which is, what is the third question? Which is how to prepare or plan for pregnancy. And in this video we will be talking about 7 things that a woman needs to consider when she is planning for pregnancy. The first thing will be her age. Second, her medical history. Third, her surgical history or operations that a woman has had before. Fourth will be her obstetric history. Fifth will be lifestyle habits and substance use. The sixth thing that a woman needs to think about would be maintaining and gaining and maintaining a healthy weight. And the last thing would be supplements that she needs to take before she actually falls pregnant. So I might actually do a part 1 and part 2 of this video because I'm not sure how long it's going to take. So in this video I'm probably going to be talking about the first 3, which is the age, the medical history, and the surgical history or operations that a woman has had. So let's talk about the first thing, which is the age. Why is age so important in planning for pregnancy? A woman's reproductive age is from the age of 18 to age 35. And if a woman falls pregnant less than 16 years old or more than 37 years old, those ages have found to be associated with more complications. For example, those women that fall pregnant less than 16 years of age, our teenage pregnancies, they have found to be associated with complications such as the woman giving birth to a preterm baby or having preterm labor, meaning that she gives birth before her pregnancy reaches full term, which is 37 full weeks. What about the other extreme ages, which are your women who fall pregnant older than 37 years of age? Those women have been found to have more of the pregnancy-related hypertensive disorders. In simple terms, that is, those women have been found to have high blood pressure in pregnancy. They have been found to have diabetes in pregnancy. They have been found to have more miscarriages and to give birth to babies with congenital abnormalities like your Down syndrome. So those are the risks or the complications that have been found to be associated with the pregnancies of women who are over 37 years of age. And we call those women and those pregnancies, we call them advanced maternal age pregnancies. So if you are planning to have babies, think about how old you are and think about the risks that are associated with these 2 extreme of the ages, and see where you fit in and see when you can actually fall pregnant. It's not to say that the women who are within the reproductive ages of 18 to 35 don't have complications at all. However, studies have found that those pregnancies are associated with less risks compared to the pregnancies of women who are less than 16 and older than 37 years old. The second thing that I said I would talk about is medical history. So if you are planning to have kids in the future, you do need to think about your medical history. Your medical history will consist of the medical conditions that you have been diagnosed with by a doctor and you are taking treatment for them. So you are taking chronic treatment over a long period of time for those diseases or those conditions. And I will be mentioning 4 conditions: hypertension or high blood pressure, diabetes, cardiac disease, and HIV. Let's talk about the first one, high blood pressure in pregnancy. If you have high blood pressure before pregnancy, you do need to think about where you are with your medical condition before you actually fall pregnant, because high blood pressure can actually cause you to have a pregnancy that's filled with so many complications, and it's something that's very dangerous to have, high blood pressure in pregnancy. So if you already have high blood pressure before pregnancy, you need to ensure that you discuss with your nurse and talk about whether your blood pressure is controlled. Are you on treatment for it, to avoid pregnancy making it worse? Because with these medical conditions, actually pregnancy can make them worse. So you want to avoid that. That's why you need to make sure that your medical condition is well managed before you actually fall pregnant. So what are the complications that are associated with having high blood pressure in pregnancy? A high blood pressure in pregnancy can lead to you giving birth to a stillborn, And it can actually also result in maternal death. You can lose your life. It can be life-threatening if it's very, very high. So what is a high blood pressure? A high blood pressure would be if your blood pressure is more than 140/90 on 2 occasions that are at least 2 hours apart. That is when you are pregnant. Then you would be classified as having high blood pressure in pregnancy if you are having a high blood pressure reading of more than 140/90 on 2 occasions more than 2 hours apart, or if you have a high blood pressure reading of 160/110 on 1 occasion. And a high blood pressure in pregnancy also coupled with protein in your urine. So when you go to your clinic and you are pregnant, they will do your blood pressure and they will test your urine for proteins. If you have a high blood pressure and proteins in your urine, that would mean you have a condition that is called preeclampsia. And preeclampsia can cause you to start having fits or seizures, things like nausea and vomiting, things like pain in your upper stomach, and that can lead to the baby getting less oxygen and less blood, and that would result in you losing your baby. So that's not something that you want to have. So it's very important to ensure that before pregnancy your blood pressure is well managed, so that when you are pregnant you don't develop things like preeclampsia later on in your pregnancy. Second thing is diabetes. If you have diabetes type 1 before you are pregnant, you definitely also need to ensure that you speak to your nurse before you actually fall pregnant, or your doctor, so that relevant tests can be done to check how you are managing your condition. Because if you are having high blood sugar when you are pregnant, that can cause fat to deposit around your baby's heart while your baby is inside your womb, and that baby can end up having a heart attack and you give birth to a stillborn. Another complication that may arise in pregnancy because of a high blood sugar is that your baby can become too big, weigh more than 4.5 kilograms before you give birth, and that can result in you having a very difficult delivery if you want to give birth naturally. Another thing is that babies who are big, sometimes the doctors will advise that you have a cesarean section or you give birth via Caesar. And a Caesar in itself, because it's an operation, it also has complications of its own and you will take longer to heal. So you want to avoid that. You want to make sure that your blood sugar is controlled before you actually fall pregnant. The third medical condition that I mentioned was heart disease. Heart disease, it's one of the conditions that cause your heart to not be able to cope with things like physical activity. So if you have heart disease, for example, if you have heart valve disease where the valves of your heart are narrowed, and then when you are doing physical activity and your heart has to pump more blood around the body to supply oxygen so that you can be able to do physical activities, you'll find that your heart cannot cope with that exertion that it needs to take, and then you will have symptoms like shortness of breath, you will start feeling dizzy, and you will feel tired, and you won't be able to do simple things like jogging or running. So that's how people with heart disease are. They can't cope with physical activity. Now you'll find that if you fall pregnant and you have heart disease and you are not on the proper medication, you'll find that when you are pregnant, your heart needs to actually work harder to pump blood around the body for you and for the baby. So the heart has to work harder. And then you'll find that now, because you have heart disease, even when you are at rest and you are not doing anything, your heart cannot cope, and you'll have those symptoms such as shortness of breath even at rest, fatigue, you'll feel very tired throughout the pregnancy, and you will be feeling dizzy. So that's also something that's very dangerous, because if your heart cannot cope, then it will start failing, and that can also lead to death. So it's very important, if you have heart disease, you make sure you speak to your nurse or your doctor, look at your condition, how is it controlled, before you actually decide to conceive. And in some cases, with your hypertension and your diabetes and your heart disease especially, you may find that it's not advisable for you to fall pregnant because you can be putting your life at risk and the life of the baby. So that's why it's important to think about these things, especially if you have these medical conditions. The last and the fourth medical condition that I want to talk about in this video is HIV. And a person would think that HIV is not important in determining whether you can fall pregnant or not, but it's actually really important, because with HIV there's the risk of infecting your baby, and there are 3 stages where your baby can be infected with HIV while the baby is still in your womb. Second stage is when you are giving birth, and the third stage is when you are breastfeeding. So if you are newly diagnosed with HIV, you need to at least ensure that your viral load, or the amount of HIV virus in your body, is undetectable before you actually fall pregnant, to decrease the risks of infecting your baby with HIV. How can you do that? You can do that by taking your treatment and ensuring that you're condomizing. So you do need to give yourself time. Once you have been diagnosed HIV positive, you do need to give yourself time to take your treatment and do all of these things that will decrease your viral load, so that by the time you fall pregnant, you know that the chance of infecting your baby while in the womb are less and decreased. And throughout the pregnancy, you need to ensure that you continue taking your treatment, so that even when you deliver, the chances are low, and even throughout breastfeeding, the chances are low. The third thing that I said I wanted to talk about and that a woman should consider is her surgical history. And specifically for this video, we will be focusing only on cesarean sections that a woman has had in the past. So now I'm talking to the women who already have babies. They've already given birth before, but they have given birth specifically via Caesar. It's very important for you to actually take into consideration your surgical history before you fall pregnant, especially after you've had a cesarean section, because with cesarean sections, there's the risk of uterine rupture. So uterine rupture is when you are in labor and your uterus is contracting to push the baby out, and you find that at that area where they cut you the previous time in your previous pregnancy, because that area is fragile compared to the rest of your uterus, it can burst open and it can lead to you losing a lot of blood. You can lose your baby, and it can also be life-threatening for the woman as well. So that's one of the most important risks that a woman carries if she's had a cesarean section before. And now this is especially if the woman wants to give birth naturally in her next pregnancy. So if you've had a cesarean section before, you do need to think about the timing of when you want to have your next baby. You need to give your scar time to heal. It's been advised that you need to at least wait for 18 months before you fall pregnant again if you would like to try having a natural birth after a cesarean section. And those women who fell pregnant less than 6 months after their previous cesarean section, they have found to have more cases of uterine rupture. So it's very important for you to think about the timing of your pregnancy. Okay, so I've spoken a lot about research, but do these things actually apply in real life? Have I, as a health professional, seen all of these things happening in front of me? Have I seen these women with high blood pressure in pregnancy? Have I seen these women with diabetes? Have I seen these women with HIV, cardiac problems? And the answer is yes, I have seen some of these conditions, and I've really seen how much they can affect a woman throughout a pregnancy. I've seen how women with high blood pressure in pregnancy and diabetes, they will be in and out of hospital throughout their pregnancy. And yeah, I've seen women lose their babies and give birth to stillborns because of high blood pressure. I've also seen women having to be constantly hospitalized throughout the whole pregnancy, even having to start injecting insulin, the ones that are diabetic. And that really affects the journey that you have throughout your pregnancy. You just want your pregnancy to be one of the most peaceful experiences, most beautiful things, and you want it to be a happy time. So that's why I really strongly believe that it's very important for a woman to just plan before she falls pregnant. Also, things like having a cesarean section, it has a lot of complications. A lot of complications can come about from actually giving birth via operation compared to when you give birth naturally. Women who've given birth via operation, they take longer to heal, it's more painful, and I'm actually going to talk more about this in one of the other videos that I will be doing in this pregnancy series, comparing natural birth versus cesarean section. So we will talk about that later. But yeah, things like cesarean sections, if you are giving birth to a baby that's low birth weight, your baby might have to stay at the hospital longer after you are discharged as the mom. And I have heard about those very unfortunate experiences of women passing away, maybe due to complications with their cesarean sections, or due to other complications maybe that arise because the mom's body could not be able to deal with the operation or any other complications that happen. So these are real life problems that women do actually go through. Babies die, women die, and these are things that if we can prevent them, let's do as much as we can to prevent them, so that we can be able to save babies' lives and save a lot of mothers' lives. So that's why I'm a big advocate of preparing and planning for pregnancy. So I think I'm going to end this video here, and then part 2 of this video will be talking about the rest of the things which I mentioned, which are that a woman needs to consider also her obstetric history, things like her weight, her lifestyle, and substance abuse, and supplements. So in the next video I will be continuing to talk about these things, so do watch out for the part 2 of this video series so that you don't miss out, so that you can be better prepared for your next pregnancy.